African governments, from NGOs, from private sector, from each individual to tackle this epidemic. It might be somebody tomorrow, it might be you. If we all lived long enough, we all are victims of cancer someday. Training and research is a tangent to successful cancer control. And what the East African Development Bank, in partnership with the Royal College of Physicians, through the British Council, is doing is the way to go. Thank you very much.
Thank you very much, Dr. Omoding, for that brief. I would like to just turn your attentions to a little sheet on your tables, ladies and gentlemen, for your connectivity. We do encourage you to tweet. The Twitter handle is #EADB Medical Fellowship. Next, we will hear from the British Council, and I would like to invite Colin Bangay, Acting Regional Director, Sub-Saharan Africa, for his very concise presentation. Thank you.
Cabinet Secretary for Health, the Chair and members of the Governing Council of EADB, Honourable Ministers of Finance, Health and State from Kenya, Uganda, Rwanda and Tanzania, the Chair of the EADB, the Director General of EADB, distinguished guests from the medical profession, ladies and gentlemen. The launch of the EADB Medical Training and Fellowship Programme marks the start of a powerful alliance between the best medical expertise in East Africa and the UK to strengthen cancer and neurological care across the region. The programme is a product born of extensive consultation and underpinned by world-class research. It is a bespoke offer carefully tailored to locally identified needs. It epitomizes the spirit of collaboration and knowledge sharing between the UK and East Africa. The partnership, from a UK perspective, draws on over 60 years of British Council partnerships in East Africa. But when we come to the Royal College of Physicians, it's over 500 years of clinical excellence, as I believe the RCP was founded in 1518, quite some time ago. It will undoubtedly make an important and immediate contribution to medical care, literally having the power to save lives. But my experience with initiatives such as these is it will do more, building lasting friendships and sparking new, powerful, and unexpected collaborations. I would like to take this opportunity to thank the leadership of EADB and its Director General for the vision in identifying this opportunity and the leadership in bringing it to fruition. In preparing, I came across who said, "We cannot direct wind, but we can push this partnership a friend and a fine crew as we all work together of others." And I would also like to say that partnerships such as these are a great, and the British Council would be very keen to hear from you. Thank you very much.
Thank you very much, Colin. Nice presentation. Up next, I'd like to invite
Honourable Minister, African Development Bank. But this isn't just finance, a bank finance. It's investment, care capacity that will, quite simply, make a difference to the lives of hundreds of thousands Through this unique package of regional training, research, specialist fellowships in the UK, and the clinical networks that are developed within, we'll be jointly tackling the growing challenge of non-communicable diseases, in this instance, and as you well know, cancer and neurology disorders. It goes without saying that banks want a return on their investment. With this partnership, we can be ensured that the return on investment will be considerable. We'll see a return in the clinical skills and knowledge acquired by the doctors that participate in this program. We'll see a return in the skills transfer that occurs when the fellows are in the UK. And here we are talking about the UK clinicians learning from their East African counterparts. We'll see a return in the development that will occur of the East Central Southern African College of Physicians, EXACOP, a platform for excellence like no other. We'll see a return in the development of regional, within East Africa, and nation-specific healthcare capacities that are robust and, what's more, sustainable. We'll see a return with a regional population of 145 million that may, through this work, access the best possible healthcare facilities for the prevention, early diagnosis, treatment and management of both cancer and neurological conditions. We'll see a return in a way of working that ultimately will see joint work on other conditions and also the cascade of our joint expertise and learning across wider Africa. On behalf of the Royal College of Physicians, what we see here is a return on investment like no other, and one that we wholeheartedly support. To this end, we commend this unique and progressive partnership, the East African Development Bank, the British Council, and we commend it to you all, because together we really can make a difference. Thank you.
Thank you very much, Steve. Next, I would like to invite none other than the Director General of the East African Development Bank, Vivienne Yeda.
Thank you. The chief guest, Dr. Klepa Mailu, Cabinet Secretary, Ministry of Health of the Republic of Kenya, Mr. Henry Rotich, Cabinet Secretary, National Treasury of the Republic of Kenya, and the Chairman of the Governing Council of the East African Development Bank, members of the East African Development Bank Governing Council, Honorable Ambassador Clever Gatete, Minister of Finance of the Republic of Rwanda, Honorable Matia Kasaija, Minister of Finance and Economic Planning of the Republic of Uganda, Dr. Savatius Likwelile, representing Dr. Philip Mpanga, Minister of Finance of the United Republic of Tanzania, Chairman of the Board of Directors of the East African Development Bank, Dr. Kamal Thuge, Permanent Secretary in the Ministry of Finance of the Republic of Uganda, Mr. Keith Muhakanizi, Dr. Savatius Likwelile, Permanent Secretary, Ministry of Finance of the United Republic of Tanzania, members of the Board of Directors of the East African Development Bank, representatives of ambassadors and high commissioners of the republics of Uganda, Tanzania, and Rwanda, Mr. Steve Crump, head of the International Affairs of the Royal College of Physicians, Mr. Colin Bangay, Acting Director General, British Council for Sub-Saharan Africa, physicians, representatives of the private sector, medical students, ladies and gentlemen, I believe I've observed all the protocols. Good morning or good afternoon. It gives me great pleasure to stand before you this morning and to witness the launch of the East African Development Bank Medical Training and Fellowship Program. This program has been the culmination of many years of consultation and intense discussion within the East African Development Bank and with stakeholders in East Africa and beyond. It has been inspired by experience as Africans, as East Africans, living and working in rural Africa, and working with the communities and seeing firsthand the suffering of patients particularly in the sectors that we are discussing this morning, cancer patients and patients afflicted by various diseases in neurology, and being compelled and seized and really inspired to do something about it. After considerable discussion, we have realized that the only way that we could probably impact the rural communities in a very rapid and effective way is to impart skills to those healthcare givers, doctors, and physicians and nurses that live and work in those rural communities. And hence the design of this program, which is focused largely on health practitioners working in our rural communities, in health centers that are in places that are far away from the urban and city centers. The East African Development Bank Medical Training Fellowship is a vehicle and a platform that we hope will address both the shortage of qualified professionals within the public sector and also provide a long-term capacity in early detection, research, and treatment, and as well stimulate further investment and research in non-communicable diseases. It is purely focused, as I said, on the doctors in the rural areas, and it is also part of a wider program to support the general health and education sector within East Africa. It's an ambitious program which we would not have been able to conceive and to launch today without the support of our board of directors and the governing council members who are all present here. And I'd like to thank them and acknowledge their vision and support and the energy they have put behind this initiative over the last 4 years. Thank you. And with those remarks, I'd like to invite the chairman of the board of directors, Dr. Kamau Thuge, to address you. Thank you.
Dr. Cleopa Mailu, the Cabinet Secretary, Ministry of Health, the Honorable Henry Rotich, Cabinet Secretary, National Treasury, and the Chairman, East African Development Bank Governing Council, the Honorable Ministers from Uganda, Rwanda, and Tanzania, Honorable Kasaja, Honorable Gatete, and Honorable Mpango, represented by Mr. P.S. Lekwalile. Of course, my fellow EADB board members, Ms. Vivian Yeda, the East African Development Bank Director General, representatives from the British Council, representatives from the UK Royal College of Physicians, distinguished guests, ladies and gentlemen. Let me take this early opportunity to thank, first of all, the speakers, Professor Joey and Dr. Abrahams, who have taught us so much about the unique situation that professionals in neurology and oncology face in East Africa. Mr. Cramp, on the other hand, has provided some wonderful facts about physicians, and not forgetting, of course, the impressive work conducted by the British Council in the region, represented by Mr. Colin Bangir. Secondly, I want to thank the Director General of the East African Development Bank, Mrs. Vivian Yeda, for her insights on the need for the medical fellowship program in the region. At the EADB, we have almost 50 years of development project finance experience, yet scholarships and fellowships are a relatively new field for us. As Ms. Yeda mentioned, within East Africa, we are very fortunate to have a young population, and with the right interventions, there's no reason why our people should suffer from preventable diseases. Given my background, ladies and gentlemen, please allow me to approach today's occasion more from the economic perspective. It's important to highlight that a young and healthy population is an enormous economic development opportunity for East Africa. If we can provide our youth with a good education and job opportunities, we are able to nurture a talented and dynamic labor force and maximize on the demographic dividend. In this regard, at the end of last year, the EADB launched a scholarship program for East African students in the STEM fields of science, technology, engineering, and mathematics. Our STEM scholarship program offers postgraduate degrees to a number of promising students, again to strengthen our regional workforce. But our medical fellowships program is even more expansive. Over the coming 4 years, we intend to conduct regional training in oncology and neurology, specialist academic and medical training in the UK for doctors looking to specialize in this area, and post-training networking for all who have benefited from the scheme. In total, we hope to train 600 medical professionals and better equip them with early detection of and research and treatment of oncological and neurological disease skills. So truthfully, ladies and gentlemen, this is an ambitious undertaking and one that I am thrilled that we are embarking on. I look forward to seeing the results of this fellowship program to our regional healthcare sectors and to the fulfillment of our economic development agendas. Thank you very much. Let me invite the Cabinet Secretary for the National Treasury, Kenya, to make his remarks.
My colleague, Cleopas Mailu, Cabinet Secretary, Ministry of Health. My colleagues also from the Ministries of Finance, from the region, Rwanda and Uganda, who are also members of the East African Development Bank Governing Council, Chair of the Board of East African Development Bank Board, and the Director General, distinguished guests, ladies and gentlemen, good afternoon. It's usually very rare to share a podium with the medics, and we were just whispering with my colleagues here that this has been a very eye-opener and a very fruitful presentations that we have had. And you know, once you are there with the ministers of finance, this is the best opportunity you can get to pitch your case, especially on the issue of financing of health. So I must say that we're really, truly grateful for the exposure we've had this morning. Very rarely do we sit for a long time to listen about very technical issues about the health. But I think what is very clear is that the challenge we have in neurological disorders and care, and also cancer, is really a great issue in our region, which certainly requires the attention of everybody, including finance ministers, as they finance many other projects that they have in their countries. So let me, since I came with a speech, I need to read. So it's my great honor and pleasure to speak this morning on this momentous occasion, which is of great significance to our region. Of course, any opportunity given to support the advancement of knowledge and skills in this region is truly an occasion worth noting. As the chair of the East African Development Bank's Governing Council, I've seen firsthand our achievements in supporting professionals, and this move to support development of skills in treating neurological and oncological disorders is indeed another feather in our cap. I therefore must express my utmost delight that we are involved in such a prominent fellowship program. Let me just give an example especially given that what Professor Joey said on neurological disorders in Kenya, and just use an example of how this fellowship is very important, using an example where some students from Duke University of the US visited Kenya. So some 2 fourth-year neurological students from Duke University traveled to a county in Kenya called Uasin Gishu, which apparently is my county, last year, to provide healthcare and local training to neurological disorders. Upon arriving in Eldoret, they were impressed with the determination of the doctors whom they met, but obviously concerned by the standards in which they worked. Inpatients in Eldoret, largest hospital, typically share one of its 900 beds with 1 or 2 others. The available medicine and equipment was also lacking, and patients' needs vastly outnumbered the doctors available, which you already seen from the presentation. The region of Eldoret has 1 part-time neurologist for a population that in the US is served by 70 full-time specialists. One standout moment from the doctor's visits was a morning when discussing a present case with a group of Kenyan doctors. The visitors saw a man suffering from seizure. When they asked what was wrong with him, they were told he was found in a ditch last night. He's just psychotic. In actual fact, the man had status epilepticus. You can see how difficult to pronounce the medical names. And that's a curable condition that, if not treated, can leave its victims in seizure for hours. It's not that the Kenyan doctors did not want to help the man. As the visitors state, they worked tirelessly to help as many patients as they could reach. They were simply not trained in neurological disease, and so were unaware that he could be helped. So cancer is also no different, ladies and gentlemen, as stated by previous speakers, I think from the doctor from Uganda. Its prevalence, as you all know, is growing, both regionally and internationally. Currently, cancer is the 3rd leading cause of mortality in Kenya, yet also struggles with lack of specialist knowledge among medical professionals. So the example above highlights several challenges facing the health sector in the region, from the number of trained specialists to the lack of medication and supplies. Despite significant budgetary allocations from the national treasuries, we continue to face major challenges to create the skills and facilities we need for our region's development and the health and prosperity of our citizens. Doctors all over the region work under tough conditions with limited equipment and training compared with the counterparts from the developed region. Consequently, a lot of neurological and oncological disorders frequently go undiagnosed and untreated. So the East African Development Bank Medical Fellowship Program, in partnership with the British Council, is thus extremely timely, as it offers the opportunity to address at least one of these concerns, which is training doctors in specialist fields in order to treat a greater proportion of the population. I want to commend them for coming up with this great idea. So I wish to express my sincere gratitude and that of my colleagues who have joined us here today to witness this very important occasion, and also being part of this program that raises hope for the region and will produce 600 new qualified doctors. The multiplier effect that will occur when our newly trained oncologists and neurologists further train those they work alongside will further boost the program, the impact of the program. So as we continue to tackle the challenges of equipments needed in our facilities and ever-present challenge of keeping qualified individuals home, this program marks a milestone in the steps taken to educate and train our own, and I thank the East African Development Bank and the British Council for their foresight and commitment to the region. Let me just add that as Ministries of Finance in the region, we are fully aware of the health financing challenges in the midst of very limited resources. And obviously, we are looking at innovative approaches to finance the health sector, including partnering with the private sector. I know the case in Kenya where we already supplied medical equipments to many of the level 5 hospitals. We are currently paying the National Treasury 4.5 billion Kenya shillings for medical leasing equipments that are leased all over the country. And as mentioned by Professor Joey, this has had big impact. But equipment alone is not enough. We need the personnel. This personnel has to be trained. And again, I want to say that this fellowship program and the training opportunities that have been offered in today's launch will certainly complement what we are doing in terms of providing at least the medical equipment. Let me then conclude by saying I would really want to applaud the partnership that has been forged between the British Council, the Royal College of Physicians, the East African Development Bank, and all the medics that have taken up this challenge. I want to assure you that the Ministries of Finance in the region will support this idea and find ways to expand and support through any innovative financing approaches to ensure that we sustain this program and even go beyond what it was conceptualized for. So with those few remarks, let me take this opportunity to invite our chief guest, who is the Cabinet Secretary for the Ministry of Health in Kenya, Dr. Cleopas Mailu, to give his keynote address. And thank you very much for listening.
Mr. Henry Rotich, my colleague in the Cabinet Secretary for National Treasury of Kenya and Chair of the East African Development Bank Governing Council, Honorable Ministers from Uganda, Rwanda, and the representative of the Honorable Minister from Tanzania, Permanent Secretaries and Principal Secretaries here, my friend, Dr. Kamau Thuge, who is the chair of the board of East African Development Bank, the Director General of East African Development Bank and the leadership of East African Development Bank who are here with you, Head of International Affairs, Royal College of Physicians, Acting Regional Director, British Council, Sub-Saharan Africa, and all the distinguished guests who are here today. It is indeed a pleasure to join you at the official launch of the East African Development Bank's medical training and fellowship program. I think this morning we have heard from very many speakers, professionals, on the reason why we are here today. And while my colleague said he had a speech which he has to read, I'm tempted not to read my speech because I'll be repeating myself. And therefore, I want just to mention a few points while we launch. We are all fully aware that in the past, and in the medicals, we are told that neurological disorders were rare. And therefore, we grew in the profession with the understanding that these are things we will not come across in our lifetime. And if we do, they will be at the tail end of what we used to call differential diagnosis. The reality is that cancer is here with us as one of the non-communicable diseases, which is emerging, and neurological disorders are with us. And therefore, we have to change tact to be able to tackle the burden of disease, which is occasioned by the two conditions. We have appreciated this morning the shortage, the paucity of staff, trained medical professionals to tackle these maladies which have been talked about by the professionals. The figures we have seen about the number of people available to tackle the two conditions is really disheartening. And therefore, while we clamor to build facilities, the ones we have been told about, to treat cancer and put in place processes and protocols to manage neurological disorders, the fact of the matter is that there's no personnel to be able to handle those conditions right across the region. And therefore, we need to change our approaches, to invest in human resource for health, and specifically, we are here today to launch a very innovative and important initiative, which is through the East African Development Bank support and the support of the British Council and the acceptance of the East African countries to work together in a partnership to enhance the capacity to tackle these two conditions. Therefore, we are here because of a felt common need to advance the care of our people. Secondly, I want to point out that it is through such a partnerships that we can now begin to dent some of the conditions we are not felt before. We concentrated on infectious diseases, and now we are faced with non-communicable diseases, which by 2025 may surpass the infectious diseases. We have been told by one of the presenters that 60% of the cancers have an etiology coming from infection. Therefore, if we tackled our infections, we might be able to reduce the pathology occasioned by cancer. Therefore, all of us gathered here today, we should encourage partnerships which bring value to the management of disease burdens within our countries. While we have cross-cutting partners who can help us, like East African Development Bank, we want in our specific countries to work together to assist countries implement country-specific approaches to management of cancer and neurological conditions. The third point is about training. The facts have been laid bare on the need of training. Yes, we can focus on tertiary training for our oncologists and others, but the key thing which this program brings is the basic training to penetrate up to the local facilities, to be able to raise the high index of suspicion of any condition presenting so that we can diagnose our cancers early and we can deal with what my colleague could not pronounce, status epilepticus, early enough so that we save lives. Therefore, the training whereby we can create awareness, we introduce prevention, and therefore early diagnosis, which will lead to cure, or the people with the conditions we are talking about, is very crucial. And I want to thank the East African Development Bank for this noble initiative, which is going to address that. Therefore, we should, as countries in the region, take advantage of the 600 trainees who are going to be trained and put them into the field to be able to manage and create awareness, which leads to prevention and early diagnosis. The figure we have been given of 150 million is really a waste, if I want to be frank, because the cancer, other than palliative care, cure is not in the horizons because it is diagnosed late, and the trips we make abroad is for palliative care. We want to make trips which bring meaning to our people and lead to cure. Which brings me to the point about the cost of care, which is prohibitive, both chemotherapy and radiation, occasioned first by the few facilities available and competing priorities, occasioned by the cost of chemotherapy, drugs, which is very high. Therefore, as we implement this program, it is important for us to be able to learn about the impediments. Yes, we might train the people, but the cost of chemotherapy is very high. And that is why initiatives have to be put in place, and as you think through the bank and through the East African community, as ministers of finance, to be able to see how do we reduce the cost of drugs in our respective countries so that access for drugs can be easier for those who are diagnosed, prosthesis for those with breast cancer and other cancers which come. The cost is something we have to address as countries. And therefore, clinicians, as you do research, you must be able to engage the pharmaceutical sector to be able to see how we can reduce that burden. So irrespective of the training, we want the infrastructure, we want to reduce the cost of care through reduction of the cost of drugs. Research is very important, as has been said by eloquent speakers, and therefore we need to continue to advance research. And we need, as young clinicians, to grow in the habit of doing operational research. A lot of the information in Uganda, Kenya, and elsewhere is buried in the archives of medical records. And therefore, we are not fully informed on the etiology, the basis, and to some extent, behavioral actions of the health-seeking behavior of our people. That is where we need to put our research so that we can be able to apply approaches which are going to benefit our people. I want to believe that there lies the cost, how we are going to reduce the cost of treatment of our people. Lastly, let me say that the challenges we face, both human resource to care for people with cancer, infrastructure to care for people with cancer, penetration of information to our people. There are challenges which we need to address as we implement this program in the next 4 years. And therefore, those all clinicians who are going to be involved should be able to address that. The benefits are many of this program. Capacity building across the board, both from the fellowship and the basic training, which is going to be taking a week. There are many, because with that number, you will raise the numbers which have been presented by some speakers here. We want to believe we will see a time when we shall have early diagnosis for our patients, which will lead to treatment and cure for cancer. We want to believe we will be able to do research so that our care and protocols can be informed by sound research. Therefore, I want to thank the East African Development Bank and the leadership of the bank for coming up with this innovative idea and program which is going to benefit the East African community countries, build the capacity to treat cancer and to treat neurological disorders. I want to thank the British Council for accepting to be the partner to deliver the product, working with clinicians across the East African community. And therefore, with those main remarks, it is my pleasant and humble duty to officially launch the program which is going to assist us develop capacity in the East African community region. Thank you so much.
This over 35 Kenyans will die today and every day henceforth from neurological disorders. This same scenario is repeated in Rwanda, Tanzania, and Uganda, totaling over 200 lives lost every day from these non-communicable diseases. And 90 to 80% of these deaths are caused by late detection, which results in late treatment. This trend is common across East Africa, and it is associated with a lack of treatment facilities and expertise for treatment, prevention, and early detection. This puts at risk the future of the East African community with the severe strain on healthcare and ultimate loss of life. But there is hope. The East African Development Bank has partnered with the British Council and the Royal College of Physicians. Together, they shall train 600 East African physicians over a period of 4 years that will focus on the early detection, research, and treatment of cancer and neurological disorders in areas where access to qualified professionals remains a challenge. This training will be organized as clusters in Kenya and Tanzania, then Uganda and Rwanda, as 5 to 10-day residentials with a mixed faculty from the United Kingdom and East Africa. The training aims to arm doctors in district hospitals across East Africa with the skills to effectively and promptly diagnose oncological and neurological disorders in order to facilitate early interventions, either at point of contact or by referral for advanced medical care. As part of this increasing specialization in East Africa and to develop a pool of expertise in oncology and neurology, the program will provide 2-year specialist academic and clinical training in the United Kingdom for a select number of high-cadre doctors in these disciplines. As a direct intervention aimed at sustainability and the retention of trained doctors in East Africa, the British Council, working with the Royal College of Physicians and the partner institutions in East Africa, will support the establishment and consolidation of a thriving network of fellows in the respective countries. This network will be both a country-based and a regional outfit with strong engagement on emerging concerns and new solutions in the fields of oncology and neurology. The end result will be having treatment facilities and expertise for the treatment, prevention, and early detection of these non-communicable diseases. And so, the East African Development Bank, in association with the British Council and the Royal College of Physicians, is investing in healthcare education to present the Medical Training and Fellowship Program. Thank you very, very much. Thank you very much. At this point, I'd like to welcome Director General Yeda onto the stage. And I would also like to invite our guest of honor, Dr. Cleopa Maelu. Right in this. Yeah, right. Okay, can you close it? Director General Yeda will be presenting the program, the Medical Training and Fellowship Program, a representation of it to Dr. Cleopa Maelu. Applause, ladies and gentlemen. Okay. Yep. Thank you. Thank you. Just stay on stage for a few moments. Okay. Okay, so just hold on one second. For the benefit of the members of the Fourth Estate, I would also like to invite our other dignitaries, Dr. Thuge, Cabinet Secretary Rotich, and all the ministers from the East African countries represented here, together with members of the Governing Council of the East African Development Bank. Kindly come on stage for our photo ops. Yes. Yep. Okay. Members of the Fourth Estate, sufficient enough? Thank you. Okay. Thank you very much. We may take our seats. And ladies and gentlemen, help me in applauding our wonderful Sarakasi Trust dancers who did a fantastic interpretive dance for us. Thank you very much. Thank you. Thank you very, very much. And at this point, ladies and gentlemen, it's a well-deserved break. I'd like to invite you for some refreshments outside. We'll take 15 minutes before we resume our program for the panel discussions in exactly 15 minutes. Asante sana. Thank you.